Hi, this is Dr. Dumestri. So thank you for this excellent question. So this person is asking, what is the purpose of ADM and do I use it in the setting of prepectoral implant reconstruction? So breast reconstruction referring to after the patient has had a mastectomy or removal of the breast gland to treat their cancer, and then I'm going in and using an implant, a silicone implant, to replace that lost tissue and reconstruct the breast. Now in ADM, what that is, it's an acellular dermal matrix, and I tell all my patients it sounds grosser than it is. So it's human skin, and it's the undersurface of your skin, the dermis, which has a lot of strength and stretch to it. So it's harvested, it's sent to the lab, they process it, they remove the human cellular component, and then it comes to me in a package, which is washed, and then this ADM is used to wrap around the implant. Now, the implant in breast reconstruction can go above the muscle, that's a pec major muscle, which is called prepectoral reconstruction, or it can go underneath the pec muscle, subpectoral reconstruction. In both cases, ADM is used. Now, I have trended almost exclusively to doing above the muscle reconstruction, and indeed I use ADM for all of those patients. And it serves a couple purposes. Number one is setting the implant position and placing the implant where we want it on the chest wall. So after your mastectomy, you actually have a pretty big hole, and if I were just to put in the implant, it would end up sitting down and out instead of up and in where I want it. The second thing that the ADM does is it forms this protective barrier against capsular contracture. So capsular contracture, one of the most common complications with all breast implant surgery, both cosmetic and reconstructive, and it's when there is thickening of the natural scar that forms around the implant. So before we had ADM, the implants had to be placed underneath the muscle because back in the day when they first started, they found very high rates of capsular contracture to the point where they deemed even placing the implant above the muscle wasn't going to be functional. So that has now allowed us to do above the muscle reconstruction. So yeah, those are the main uses for ADM. I do use it in my practice on a very routine basis for immediate reconstruction with implants. I hope that helps, and you have a great day.